I'm Talcott Franklin. I'm here with Dr. Wilfredo Rivera. Dr. Rivera is an emergency room doctor, and I'm also here with Dr. Anthony Riccio. And Dr. Riccio operates on kids who have traumatic injuries. So thank you guys for doing this. We're here to talk about childhood injuries and how to prevent them and what to do when they happen. And childhood injuries are the leading cause of death among children ages 1 to 19 years of age. That's about 40% of deaths in that age group. Every year you have about 9 million children who are treated for injuries in emergency departments and more than 225,000 who require hospitalization. There are about 9,000 children each year who die as a result of these unintentional injuries. The 5 leading causes of death among children are, first off, suffocation for the youngest. Secondly, motor vehicle collisions. Third, drowning. Fourth, fire and burns. And then fifth, poisonings. And lastly, falls. And that order changes, even though I've listed 6, that order changes depending on the age group, which is why I listed 6. So we're just going to go down the list of these most common injuries and talk about how to prevent them and what to do about it. Let's start with number 1 for babies, suffocation. How do you keep a baby from suffocating? Dr. Rivera.
Well, first of all, we need to make sure that, when we put kids down in bed, they're, facing on their back. They're on a fairly hard surface. I mean, that's why kids' mattresses are different than adults and regular beds. Keep all the soft, kind of pillow-like things from the bed. Anything that they can roll over and kind of press on their faces, that, it's a big hazard for them. Obviously, putting them in their crib versus putting them in our beds, it's the way to go. And why is that? I mean, kids, they're by you, you fall asleep and you roll over them, and that's it. I mean, they just don't have a chance, you don't realize it, and then they can suffocate. So anything that can cover their faces in the crib or in the place where they're sleeping is kind of a big no-no.
When I had our first child, I bought a mobile for the child, and I understand that was a mistake on my part. Why is that?
It's because obviously those things can actually fall in their beds. Anything that can get there, they eventually can grab and pull down, put in their mouth. All those things are a big hazard for them, suffocation-wise. Right. So that's why we should keep them out of that place.
And suffocation also includes choking.
Definitely.
So what kind of things should you be doing in terms of feeding?
Okay. So obviously we have to look at things age appropriate. So the most common example that I try to give people is you give a toddler something that's round and that can occlude their windpipe, and that's bad. You have to cut the things to the appropriate size where if they swallow it without chewing it, which they will do, it won't be stuck in there and they will stop breathing. That's kind of the main thing. And so all those things are age appropriate. Obviously, if you have a 5-year-old, they'll be able to basically chew that and swallow, versus a toddler that's not going to be able to do that.
My kids also have trouble sitting still while they're eating. What about running and playing during eating? Is that a good idea?
So the same thing. It's not a good idea. The main reason is because things are going to go the wrong way, right? If they're sitting down, they're chewing, they're swallowing, things tend to happen like they should. They're running, they're screaming, they fall. Here goes that piece of apple through the windpipe instead of going down the esophagus, which is where the food should go down, and then to your stomach, and then that's where we get into trouble.
And then the other thing is CPR. Can you talk about the importance of that?
CPR is very important. Obviously, we can control a lot of things, but there are things that are beyond our control, and that's when you want to be prepared for those things. So included in CPR is, first of all, is what to do if one of those things happen to your kid. If they stop breathing, there's some certain steps that you should do. If they're acting different, if they're lethargic, if their heart stops, their breathing stops, all of those things will be covered in those types of basically tests and the training, and that's what's going to help you make the right decision at that point in time.
Yeah, and the reality is that you couldn't be less of a doctor than I am, but I took CPR and I could figure it out. I mean, and it did not take, it's not that big of a time commitment, frankly, and the benefit of it is enormous, because there are times when you're not going to get to a hospital. You don't have time. And so that we can't stress enough the importance.
And the most important thing is people actually the reason why most people don't do the CPR is because they're scared. They think that's really way beyond what they need to know or what they're willing to learn or what they think they can learn. And it's nothing like that. I mean, the CPR is a very basic course, and it's meant for everyone. So, I mean, go ahead, and if you have kids, if you're planning on having kids, make sure you get that. It can be a lifesaver, definitely.
Right, and if you've taken CPR for adults and you have a kid on the way, it's different with kids.
It is.
And you need to retrain yourself.
You need to retrain, and the most important thing is you should retrain and redo it about every 2 years or something like that. Because if you don't do it regularly, like unfortunately we do, and I say unfortunately because we see a lot of kids that actually need it. We wish that no one would need it, but if you don't do it on a regular basis, then you should retrain and kind of refresh your memory with different things.
All right. Let's turn to number 2, which is motor vehicle accidents. Dr. Riccio, you unfortunately see a lot of those. Talk about some of the issues there.
The problem with motor vehicle collisions isn't just the mortality rate, which is fairly high, as you've mentioned. It's also the morbidity associated with these collisions. And we see a lot of these at our level 1 trauma centers. Severe head injury, devastating neurologic trauma, spinal cord injury, spine fractures, extremity fractures, intra-abdominal and thoracic injuries. These things can be devastating to a child with regards to function as well as their livelihood and the well-being of their family.
I mean, the issue is you're driving, you're in a hurry, you have to remember someone else is in the car, and it's just really important. And then the second thing is child seats, where they go, following the instructions. It's a pain. I mean, we're all dads. We've all had to put in child seats, both in our own cars and you're on vacation, your unfamiliar car, trying to put it in, but you have to put that thing in rock solid, and you've got to take the time to do it properly. And if you do it properly and you are in an accident, it really can make a difference for the child, right?
Absolutely. Surprisingly, recent studies have shown that less than 60% of children involved in motor vehicle collisions are actually restrained at all. Or properly restrained.
That's
so
amazing.
The rate of unrestrained children or improperly restrained children is very, very high. So having the proper restraint available and then using it correctly, as you said, is essential.
Yeah, and you're going to have, the type of seat you have will have instructions as to what the proper height and weight is, and you've got to follow those.
Absolutely.
And you've got to install them properly, and they go in the back seat, they don't go in the front seat. I mean, they're rear facing up to a certain point in time, and then the child turns around. And a lot of kids have a tendency to beg to get into that booster seat before they're ready because other kids are riding in them, and the reality is you take a risk when you give in to them.
So the American Academy of Pediatrics outlines their recommendations with regards to child seat use. And the truth of the matter is that the longer you can keep a child in a rear-facing seat, the safer they're going to be, regardless of their age and regardless of their weight. Traditionally, by age 2, most people will turn their child forward-facing. At that point, it becomes a matter of weight and height before they transition to a booster seat. The principle behind a booster seat is simply to elevate the child to a higher level so that the standard lap belt isn't resting around the child's abdomen, so that if they were to get into an accident and be thrown forward, the pressure would be against their pelvis and not against their thoracic spine, which could result in spine trauma and spinal cord injury. In addition, the chest component of the belt, when a child is on a booster seat, is brought down to their chest as opposed to resting around their neck. I mean, you can imagine what would happen if a car stopped suddenly with a chest belt across a child's neck, causing them to flex forward.
Let's turn to drowning. That's the next major category of injury. It's surprising how little water a child needs to actually drown.
Yeah.
Talk about that.
It's very interesting. Think about a kid's face. They're flat, their noses are really little. About 2 inches of water is all they need. if they fall, or they're trapped face down in 2 inches of water, that's enough for them to drown. It's incredible. We don't think about it that much. So, you know, kids, once they start moving around and walking, we all want our kids to start crawling, and then after that we want them to run and walk and whatnot, and we don't know what we're wishing for, because then you spend the rest of your life kind of following them throughout the house.
That's right.
But buckets of water, toilet, all those things are hazards for these kids. Why? Because they don't have the upper body to push themselves out of that.
The toilet surprises me. Most people wouldn't even think of that.
You leave them open, they go in, they're looking in there, they fall face first, and they will not be able to push themselves out of there. So that's, you know, easy way to lose a kid. I mean, we have to be really vigilant with these little ones, because they'll get into anything, and those things can be really harmful.
And you can in fact buy things to keep the toilet lid down so that they can't get in
Definitely.
there.
That's why, you know, there's locks that will go on top of that toilet seat so they can't open it. You should be careful with, like I said, you know, you're doing cleaning, doing everything, just, you know, empty that bucket of water and leave it there, so they can't get into it. So.
And then, you know, your risk increases if you've got a swimming pool or a fountain or something like that. And, you know, one of the amazing things that most moms don't know, and most dads, I certainly didn't know before I had kids, was how young a child can learn to swim. And learn to swim in, you know, like in an emergency situation if they were to fall in. And you can teach your child, not you yourself, but there are people who teach children, very young children, how to float on their backs, how to be able to get out of a pool. They test them, they get certified. All of our kids went through that.
They did.
It was tough. You know, the kids weren't happy at first, but now they love to swim and they love the water, and they certainly weren't traumatized by it. If anything, it made them stronger for that, and it's a gift to be able to swim.
And if you have a pool at home, you have to make sure your kid knows how to swim. There's no way around it. You can put, you know, obviously we have to think about putting fences, locking our doors. It's not enough to lock the door inside, because there will be an instance where your door will remain open, and that's when it only takes a second. They walk out of there and they fall, and you'll be surprised if you ever see a toddler fall in a pool, which we've seen before. They don't make a sound. You think that they're going to make a splash and you're going to hear it. You will not hear it. You will not. I mean, I can guarantee that. And that's why pool fences, or, you know, any sort of safety device. There's many different devices out there. There's, you know, the nets, the fences, you know, keep your pool out in a place where you can't get into. I mean, there are many ways of doing it, but even if your kid knows how to swim, which is kind of what we want, just still, you got to keep it locked for, you know, that party that you're going to have at home, and then the other toddler that doesn't know how to swim and end up getting in trouble.
Or the kids don't make great decisions all the time, and sometimes they decide it's a good idea to jump off something near the pool or put something up that's bound to fall, you know, and then they could fall backwards, hit their head. You just cannot, it's just not a good idea to leave a kid in a swimming pool unsupervised. And then, you know, Dr. Riccio, you grew up going to the beach. You have a place on the beach. I mean, talk about open water and some of the hazards that represents, because that's something that a lot of people, the ocean looks really safe to a lot of people. You know, it's the beach, it's nice, it's relaxing, it's calm. I'm just going to read a book, I'm going to close my eyes, the kids are going to play down there. Why is that not a good idea?
Obviously the ocean has all the risks that the swimming pool has over an unrestricted area, with the additional dangers of undercurrents and undertows. And obviously in a larger area like a beach, it's harder to keep track of your child and easier for them to wander off and get into the water. And B, undertows are a real problem. And for those of us who spend time in the ocean, all you have to do is step in 6 inches before that undertow can grab your feet. And especially in a child who's got a lower center of gravity, it can take them under, take them out, and that's all it takes for them to drown.
And it's hugely tragic because the parents often are right there. And, you know, there have been cases of people watching their child get pulled out to sea, and it's just something you have to be very aware of.
And it does not have to be a stormy day. There do not have to be waves present. The undertow can be present even in areas in the ocean protected by jetties and sounds.
let's talk. Go ahead.
Before we move to another topic, especially where in the States we have all the lakes that we have a little beach and whatnot, and people like to go in the lakes. If you live in Texas, our lakes are not really clear. So if your kid can be by your side, and if they go under, the chances of you being able to grab that kid are very, very low. So they can be within a couple of feet from you, and they go down, and you may not be able to find them. So that's why life jacket is very important for the kids that will be playing around there, unless they're probably knee high or something like that. They should go.
And obviously, if they're on a boat,
Yes.
it's an absolute requirement that they wear a personal flotation device.
Yeah, because you never know with the boat. And talking about, we're going to get into summer and those types of injuries in a minute, and we definitely want to talk a little bit more about boat safety, because there are a lot of traumatic accidents that happen with respect to that. Let's move to the next most significant category, which is burns. A lot of the burns are such a, all these injuries are terrible. This is one that can be avoided in a lot of situations by just some planning around the house. Can you give some examples of what people ought to be doing?
Yeah, definitely. First of all, your smoke detectors, it's a big deal. But talking about planning, which is you have to have an escape plan. In our houses, most of us have master bedrooms on the first floor. The kids are upstairs. If you have a fire in between you and the kids, what's going to happen? They need to know what they're going to do. So they're not going to jump up the second story window, but you can have ladders there. There's some things that you can put under the windows that you actually roll out, and they can kind of go down. You can go in from outside. You just have to have a plan. If this happens, kids, if you're here, if there's smoke, touch the door before you open it, because if there's a fire out there, then you open, oxygen will just bring it all in. So things like that are kind of simple enough, but you have to plan for it. And obviously the fire department's always available. In most places you can call them, they can do an assessment of your house, come in and tell you the right places to put certain things and what to do with it, and to create a plan that's effective for you and your family.
And then smoke detectors, obviously, in every room you can put them in. Now, another issue with burns is water. Before we had children, we had this water heater that was great, because when you turned on the hot water, it was scalding hot. You could just, put some water in a pan and boil it in just a few seconds. But we had to turn that down. Why did I have to do that?
Because kids will turn that knob, the wrong one, on, and they'll get in there, and they'll get really, really nasty burns that can scar them for life. It's very significant.
And space heaters, another issue.
Space heaters, space heaters are problematic because people leave them on, and they, the curtains catch on fire and whatnot. But other than that, if you leave a kid unattended, most of these have some sort of protection, but a lot of them don't. Yeah. So their little hands will fit through places that you wouldn't even imagine they can. You see horrible burns to their hands. They get stuck, like you said. They'll tip them over. They can get burns, all through the body. It's just a lot of damage. They can do a lot of damage.
Yeah, I can't imagine that situation. It would just be horrible. And then cooking is another issue. You cannot walk away from the stove when you're cooking and you've got kids in the house. It's just, it's hard, but that's something you've got to be very vigilant about, because you see a lot of that too.
Careful with. We see a lot of injuries that could be prevented. For example, you're boiling water, you're frying something, you have that cup of tea in there. If you leave it close to the edge, a little toddler can't really look and see what they're doing, but they can reach and pull things. And that's when we see the injuries. They spill everything over them, so you see a lot of those, chest burns, even a little bit of facial burns, because they usually kind of look back, but it'll get them anyway. So you get significant amount of burns from those type of injuries. So keep things away from the edges. Cover your, where you're cooking, your cooking surface. If they can get over there with their hands, there are all sorts of things that you can put in there to cover it, so they can't reach the burning kind kind of cooked up there. So a lot of things that you can look at to prevent those type of injuries.
And another one is just keeping them away from
Away
the
from
stove
there.
while you're cooking. Let's move to the next category, poisonings.
Okay, so kids, like, you know, in that same story, they will get into a lot of places that you think they can't get to. I mean, my kids have step stools that they move around the house, and I was surprised the first time I saw a step stool move from, you know, the kitchen to the bathroom, and my 2.5-year-old was actually putting it there. So keep your medicines. Let's back up a little bit. Let's start with chemicals. Household cleaning products have things that can be very harmful for the kids. So the Poison Center has a lot of information in their website where they explain how to child-proof your house for these type of things. But simple things: don't store your cleaning supplies under the sink. They'll get to that. They'll get there unless you can put some sort of lock that they can't really get to it. Then yeah, do it. But if you can prevent it, if you have another place to put it, then put it over there. Medicines, medications. You know, grandma came to visit and you put away all your med, but grandma came in and she takes her little pill minder and one of her blood pressure meds kind of falls out, and then the kid grabs it from the floor. I mean, you have to, everyone that you have in your house have to be really careful what they do with their meds. Your meds, if you have medications, obviously put it really high up so they can't get to it. And then if they by any chance get to something, then what to do? First thing you should do is obviously see what the kid looks like. If they're breathing, they look like they're acting normal, then call the Poison Control Center. It's a really easy number to learn. It's 1-800-222-1222. It's a national number. Wherever you are in the States, Hawaii or Puerto Rico, you will be routed to your closest Poison Center. And they will give you the instructions and the information you need. They will tell you if you should take your kid in to the hospital or not. They will give you a follow-up call to see how he's doing, he or she is doing. They can identify pills. If you don't know what the pill is, I know that's very frightening to people. Every pill has an ID code imprinted in them. And if you call the Poison Control Center, they will ID that pill for you and let you know what the correct steps are after, you know, whatever happened. So very dangerous things also in our garages. Something that a lot of people do that we shouldn't do is change chemicals from, you know, their original container to other containers. People love to put, you know, their wiper fluid or, you know, their oils in Gatorade bottles, in water bottles, and then leave in the garage. Well, guess what? You know what's in there. If you don't write it in that bottle, no one will know what's in there. Your kid may come back from riding their bike and they see the water bottle with some clear fluid and they may just take it in and jug it, and then that's when we get in trouble. You get aspirations, pneumonias, I mean, lots of complications of things that we could avoid.
Yeah. So, and then one other point on this is just, which follows up on what you were saying, was, you know, you think it's up high enough, but your kids will really surprise you at how adept they are at climbing things. Mm-hmm. And so, you know, if there's a counter nearby or something like that, and you're thinking, yeah, there's no way this kid could get on top of this counter and reach up there, you're wrong. They will do it, yeah. And they will surprise you pleasantly many times, but sometimes unpleasantly, and so you really have to be careful about that. And then the other thing that's just common sense, but people don't think about is, well, I've got the candy where they can't reach it, and so I'm going to put the meds up there too. And of course, that's just a recipe for disaster. And so, you know, yeah, they could never get the candy, but if they ever get there, you've got a problem, because they logically would think, well, here's some more candy. And so you've just got to separate it from things that are something that they want, I guess.
And that's why those locks, you know, cabinet locks and all that are so important when you have kids. Because like you said, they will get up there. Yeah. They will find it.
And so while we're on the subject of climbing up on high things, we move to falls. And let's talk about that a little bit. Like, what are some things that can be done to prevent and reduce the trauma here? Because kids are going to fall down. It's going to happen.
Kids fall all the time. And if you put them in a situation that are at a higher risk for their fall, they're more likely to fall. Falls that we see that bring them to the emergency room and certainly that bring them to the operating room most often occur from things like playgrounds, monkey bars, trampolines, bounce houses, and that sort of play equipment. So these are the places where you really have to be vigilant when your child is there and inspect the area. You want to make sure that the padding and the ground of these areas is soft. We prefer things like mulch and rubber composites that will take in some of the impact, lessen the chance of injury. It doesn't always work, but it certainly can convert a more severe injury to a less severe injury. You want to look not only at the landing and the grounding, but you want to look at the equipment itself. Is it old? Are there loose bolts, loose nuts? Is it rusty? Is it slippery? Has the knurling around the monkey bars worn down, which means there's less of a grip and more likely of a chance the child will fall. I'll tell you that the number one cause of operative upper extremity fractures that we see are due to falls from monkey bars and playground equipment. So it's an area where parents have to pay particular concern to their particular attention to their children.
Staircases.
Very dangerous. Until children become very adept at using them, it's absolutely mandatory that parents block them with some form of gate that either locks onto the stair railing or onto the wall. Obviously, much like swimming, it doesn't hurt to teach your child how to hold on to a hand railing and go up and down the stairs. They can learn that at a very early age, and the earlier they do, the safer they're going to be when they're unattended. But in general, it's a bad idea to keep your child unattended around a stairway, and certainly not to have it blocked off so that if you're not there, they don't trip, fall, and stumble down. And stairways is just the beginning. There's lots of hazards in the house. We look at the spacing between grates up on second stories of floors or second levels, balconies outside. A child's head is surprisingly small, and if their head can fit through a railing or spacings between a railing, their whole body can follow. So when we see devastating falls from great heights, it's usually because a child slipped through some protective grating around a balcony, and the parents had no idea that they could ever fit through it when in fact they could. And it's not just the spacing of the grating in those railings, but it's also the height of those railings. Obviously it has to be something that they can't climb up and it doesn't have a foothold. Usually some of these have decorative facets to them that a child can step up on and then fall right over.
Yeah. You know, one thing I see a lot is a child falls and the parent immediately runs over, or the child's injured, you know, they're playing sports or something in the yard. There's a collision, a fall, and the parents immediately run over and scoop up the child and hug. But I see in the NFL, when a player gets hit, right, nobody's running over to hug them. They keep them still and they talk to them first, and you know, talk about why that is. I mean, I assume the NFL knows what it's doing on this, so talk about why they're doing it maybe right and some parents aren't doing it right.
Well, it's interesting about what you're talking about is cervical spine injuries and neck trauma in the NFL, and children are certainly subject to those types of injuries as well, especially during sporting events. In fact, we think that children are actually at a higher risk for cervical spine injuries because the ratio of their head to their body is much greater. Children have a larger head than their body. Their head's they have that normal size to their head by age 8, but their body is still catching up. Heavier head means more force when they have a flexion type injury to the spine. So yeah, obviously any type of sports collision, it behooves the parents or the trainer or the coach to at least inquire and see if the child, or ask the child if their neck hurts. In football in particular, a child should not be scooped up, as you mentioned. The neck should be stabilized in line with the child. The helmet should not necessarily be removed on the field. It should probably be removed in the emergency room by our emergency room colleagues, and they should assess the neck for any tenderness. You'll see the EMTs will put a cervical collar on to stabilize the neck during transport, and that's for a good reason. Any type of fracture around the neck, any type of ligamentous injury that causes instability could result in spinal cord injury. And a spinal cord injury up in the cervical spine can be life-threatening.
So what do you do if you the kid got out of your sight? A great example, you're skiing. Kid gets ahead of you, you catch up, they're laying there. Do you pick them up? Do you talk to what should you be doing first?
Well, I think the first thing you should do is call for help. Any type of ski facility, any player, you should call someone who's a professional who can assess the child if they look like they're severely injured. Kids, for the most part, if they're not badly hurt, will bounce right up and get up. If they're lying there severely hurt, I would not recommend that the parent just picks them up. I'd recommend they call a professional for help. And if there's any concern about the neck or cervical spine, it should be stabilized by the parent to stop the child from trying to move their head, which could potentially cause more damage. Angulation of the extremities that does not look natural or normal should not try to be straightened out by the parent. They should probably, in that very acute setting, just be stabilized and immobilized where they are till someone more expertise gets there.
Well, those are sort of the top causes of childhood injury. Now we're going to talk about a bunch of different ones that, a lot of these are just frankly preventable. And some of them don't happen that often, but a lot of them do, though. We're going to start with slides. Going down the slide, Pump It Up or one of these places, and I think you see this a lot. The parent wants to keep the child safe. So the parent decides that the plan is to put the child sort of on their lap or in front of them a little bit, and then they're both going to go down the slide together. And I'm told that's not a great idea. Why is that?
We've had,
Go ahead.
Can I feel this one? Oh, sure. I guess I'm the guy seeing most of the lower extremity fractures. There's a weight differential between a parent and a child. Acceleration down a slide kind of depends on the steepness of the slide, but also depends on the mass that gravity's acting on. And obviously a parent's going to have greater mass than the child. Because they move at differential speeds, the parent will kind of take off a little quicker. The child tends to get wrapped under the parent, and there's usually either a collision between the two or a twisting of the parent over the child that characteristically results in tibia fractures or fractures of the lower leg. It's commonly reported in the orthopedic literature, and for whatever reason, parents aren't aware of this. Children are much safer going down slides by themselves with a parent at the upper end of the slide guiding them down, and a parent or another adult at the bottom of the slide catching them.
Lawnmowers. Now here's something that I really wouldn't have thought of that much, which is Grandpa decides that it would be fun for the child to ride on his lap while we do the driving lawnmower. And what can go wrong there?
Yeah, I mean, it's uncanny how many traumatic amputations we see a year due to lawnmowers and farm equipment in general, but especially lawnmowers. This typically occurs on riding lawnmowers, like you mentioned. Everyone thinks it's going to be fun for a small child to ride along. There are no restraints. There's no seat belts on lawnmowers. One bump, one turn. If the parent's not paying attention, the child can fall off. Traditionally, we see loss of toes, feet, anything up to the ankle. Hand injuries are super common. When these occur, they're mangling injuries, and frequently, if an amputation wasn't caused by the lawnmower, we're going to end up completing it in the operating room. Obviously, there's bad soft tissue injuries that go along with these as well, not just fractures. So children are frequently subject to numerous surgeries just to get soft tissue coverage over severe wounds with skin and muscle loss. The result is severe disability. Oftentimes the result is amputation requiring a prosthesis. This can obviously happen with push mowers as well. If a parent's not paying attention to where a child is as they're mowing the lawn, the child trips, falls, runs in front of the mower, the parent can't stop in time, and the child gets run over.
And what surprised me most was this is not like some one-off thing. This happens with some frequency.
Yeah, during at least here in Dallas, during the spring and fall months, especially as yard crews are getting lawns cleaned up, as parents are or adults are doing their spring cleaning, getting their lawn looking good, We see on average of 2 to 3 lawnmower injuries a week.
That's amazing.
The rate is exceedingly high, and every single one of these is preventable. The injuries are among the worst extremity injuries we see in pediatric orthopedics.
And, as another summer activity, of course, is boating. We talked about wearing a life jacket on a boat, but there's another piece of a boat that's similar to a lawnmower,
Yeah,
and that's the propeller.
yeah.
And the issue there is
Yeah,
what happens.
the classic mistake that parents make is when children are being towed, water skiing, wakeboarding, or tubing, and they circle around to pick up a child, or if the child's just swimming in the water and they circle to pick up the child, they don't turn the engine off. Some of these propellers, even if you put the boat in neutral, will still spin somewhat. Sometimes it doesn't lock into neutral and the propeller is still spinning. So whenever a child is in the water around a boat, the engine has to be off. That's the only way to be safe around a propeller.
Yeah, you're exactly right. Lifelong boater, and you think it's in neutral, it is often not, and the injury is horrible.
And to speak, locally in this area, injuries, and Wilfredo can tell you this, injuries that happen in freshwater breeds all sorts of bacteria that you're not going to see out in a playground or on the lawn, or the bacteria that are living in the lakes, and not just here but across the country, can be extremely virulent, extremely hard to treat, and can result in long-term infections that require multiple surgeries and prolonged antibiotic treatment.
And that's just from a cut.
Exactly.
From a simple surgery that recoup is a couple of weeks, they spend 9 months between multiple surgeries, IVs at home with antibiotics to the IVs. Prolonged recovery is just kind of incredible.
Let's talk a little bit about helmets. Talked about the National Football League earlier. Big issue in there with concussions and significant consequences related to those. Children are very vulnerable to head injuries too. Why?
Because what Riccio here said initially, the ratio of their head in relation to their bodies, it's incredible. Most of their weight is actually going to be up there. So falling and hitting their heads is usually has a lot of force, a lot of momentum forward. So we see, kids on their bicycles, for example. If they're going to go from here to the corner, just have them put their helmets.
Habit.
Yes, they have to do it all the time. I have one of the coaches from one of the triathlon clubs I kind of hang out with. He was going to the parking lot from his car to start a race, and thankfully he had his helmet, but his bike got stuck on a kind of a grate in the floor, the road, and he fell over, kind of flew. The indentation on his helmet, he was going less than 5 miles an hour. The indentation was about 1 inch.
Wow.
And that would have been his head, his skull. So that more than likely would have been a terrible brain injury for him. So kids are the same. You only need a couple of feet for things to happen, so you just gotta wear it. And we were mentioning the football too. If an injury happens like that, parents shouldn't rush in and take their helmets off. The pads on those kids, they're playing about yay big, right? So you have a pads that thick, and then the head is a helmet. If they're laying flat on their back, their helmet's actually supporting their head at the same level of the spine. Now, you take that helmet out, the pads are still going to be there, the head's going to fall down. So if they have an injury in their neck, that injury is actually going to get worse. So that's what's very important, just to leave them like that, leave the helmet on until someone that's actually trained and taking care of that can go ahead and aid.
Yeah. I've been pleased to see, as a skier, virtually every kid on the slopes now wears a helmet. And, if you think, well, it's snow and it's soft, I myself have been, skied my whole life, and I've been standing on a patch of ice and you just slip and you fall backwards and you hit your head and it hits hard. And unfortunately, I wear a helmet, so it's not traumatic, but it certainly would have been had I not had the helmet on. But there are other things that people don't think to wear a helmet on. You know, biking surprises me that there aren't more kids wearing their helmets, although it seems to be trending towards wearing helmets, fortunately. But things like sledding and inner tubing, you never see a kid out there with a helmet, yet that seems like an activity where you can really, you know, get 2 or 3 kids in the same tube together. What's going to happen? You know,
So, yeah.
and you know, or they you know, slide off into a tree or something like that. I mean, it just makes sense. But also horseback riding seems like an activity that, you know, if you've got a helmet, put it on, you know, even for the little one that you're just kind of doing it for, you know, a fun thing. I mean, horses are high up, kids are small, horses can step on their heads. I mean, it just makes sense to have some protection.
Yeah, and just by falling from up there, that enough can cause a severe injury. So, I mean, these helmets are, you know, through some rigorous testing. You know, the bike helmets are different than the ski helmets, just because obviously the bike helmet, they're tested, because if you fall into a rock or something like that. It's a sharp thing versus, you know, the snow, which is different. But other than fractures, we see a lot of injuries that basically involve the brain just moving, just shift back and forth. Our skull it's a dome that's closed. It's a closed cavity. So the brain kind of is floating in there and has a little bit of space to move. So if there's a lot of force kind of back and forth, that can create what we call a coup counter coup injury, which the front part just touches there, but then the rebound, the other part is where you get the big injury. And that's why most of that energy is absorbed by the helmet, if you have a helmet on. If not, all that energy gets transferred directly to your brain. Kind of the same rationale with cars. You know, they have all these wrinkles, you know, zones where they wrinkle here and there, so they absorb in the energy so that it doesn't get to the passengers. The same thing as the helmets with our brains.
Let's turn to trampolines. What do you see with those?
Yeah, bad upper and lower extremity fractures most often. The thing about trampolines is most of the injuries we see occur when numerous children are using it simultaneously. The number of children on the trampoline, or the bounce house for that matter, increases the likelihood of collisions, subsequent falls, or one child falling on another. The fact that they're moving up and moving down and sometimes getting quite high up in the air increases the velocity and energy of these falls, and therefore the severity of the fractures we're seeing. We obviously still see a lot of injuries on trampolines and bounce houses when children are alone on them. That's usually a result of them falling off of the device. Some of these trampolines have optional netting that can be raised. That adds some level of protection, but by no means does that make them completely safe. They should only be used under parental supervision. We do not recommend allowing children to do any tricks, flips, high jumps, and parents need to understand that no matter what protective device they put around a trampoline, they're still fairly dangerous play devices and need to be treated with respect, and children always need to be supervised.
And one other thing that I've noticed, some bounce houses have started to do, which I think is probably a good idea, is, you know, yes, they have multiple children in them, but they try and keep the children about the same height and weight. Adults and kids on trampolines,
Yeah.
bounce houses is not a good combination.
So Tal, if we think about a trampoline, it's just this big surface area that's obviously very bouncy, right? So you have one person jumping, the trampoline is moving all the time, it's moving with that person. It goes down with the person and it just pushes them up. They go down, trampoline goes down. Now you have two bodies going up and down in that thing, especially if you have an adult and a kid that has maybe twice the size and the weight of the kid. They both go down, they come up, the parent comes down, the trampoline now is taut completely. It's stiff as can be. The kid's coming down from 6 feet, going down, it's the same as going down into concrete. So that's where we see so many problems with it. And if the parent's coming down, the trampoline is actually tensing upwards while the kid's coming down, the force may be doubled or more. And that's going directly to that, you know, the injury to their lower extremities, even their backs. So Very, very, very scary.
Here's one that is unusual: the foreign objects in the nose or ear. You see that?
See that a lot in the ER.
You know, obviously you want to look at the toys your kids are playing with and just make sure that they're not, you know, if the child is young enough that they're going to stuff something in their nose and their ear, you probably shouldn't give them something that they can do that with. With that said, you know, let's say if they get a hold of it, it happens. What's the...
So you'd be surprised how many kids that we think shouldn't be in the age of putting things in their nose or their ears that we see in the ER with things in their nose and their ears. Beads are kind of usually the culprit. They love, you know, putting beads in their ear. I don't know what they were looking at. We're going to see what happened. We have a lot of techniques that we can use to take those out. So unless you can see it, the easiest way, for example, if it's in the nose, just your kids, it's, you know, big enough, ask them to kind of blow their nose. You cover the other side where the thing is not there, and then you ask them to blow out. And most of the times this comes out. Sometimes it doesn't work that great, but sometimes it does. In their ears, don't go fishing for any of that stuff. You know, seek the help of the specialist. All those foreign bodies, what's going to happen is you're going to irritate the ear canal. It's going to swell up, and it's going to cause more damage than what it really should. So leave that one for the specialist, and they'll help you with it.
How about cuts and scrapes? Every kid's going to get these. It's fact.
Yeah.
So what do you do when it happens?
Well, you know, do you want to tackle that?
Oh,
See
cuts
what-
and scrapes. Yeah, I mean, I think, you know, the majority of cuts and abrasions are going to be able to be handled by the parent. I think the most important thing is just to clean it up as thoroughly as possible. And unless the emergency room's recommending something else, we typically just recommend cleaning it with soap and warm water, making sure there's no retained foreign material. Kids tend to fall on the street, on the sidewalks, or in grass, so you got to look for retained dirt, little pebbles and rocks. Those should be removed, even if it requires a little washing with a face cloth or a brush to get it clean. After that, kids have an amazing capacity to heal. So maybe using a little antibiotic ointment if there's any, you know, concern about the risk of infection or contamination that was removed, and then keeping it covered is usually all it takes. Obviously, parents should keep a close eye on all cuts and abrasions to look for signs of infection that might require visiting an emergency room or their primary care physician. These things include things like redness around the wound that wasn't there the day prior, swelling in the area of the wound, certainly any drainage, purulent yellow-green drainage is a hallmark of infection. Increasing pain is also something to be concerned of as well. Abrasions typically will hurt when they occur and then get progressively better over the next hour and certainly by the next day. If the pain gets worse and worse, it could mean an infection either superficially or even a deep infection, which children are prone to when bacteria gets into the bloodstream through an abrasion or a cut.
And always keep in mind where was your kid when this occurred? It occurs in the lake, like we mentioned earlier. Either in the, you know, in the water, in the ocean, or, you know, it was close for, you know, a dog park where there's all sorts of like feces and some other things around there. So all those things are kind of for you to keep in mind to look for all those signs and symptoms of infection in the next 24 hours.
Contusions or bruises, what do you do with those?
Kind of ice and elevate it's a simple thing. So basically a contusion is, you know, a kid falls, they hit their extremity, their arms or whatnot. It's not cut open, but it hurts. So ice packs. So if you have, you know, first aid kits in your house, with, you know, they can have those ice packs that you should kind of break and then they get really cold. Elevate the extremity, clean it, protect it so they don't hit it again. Really simple, straightforward things.
Yeah. And ice works amazingly well.
It does.
And the main thing is you don't want to put it directly on, right? You put something between it so that there's some...
Except for if you're using one of these prepared ice packs or cold packs, they usually do have a membrane in between that's made so that you don't actually get a burn from the cold, which is what you can get if you put ice directly to your skin.
Eye injury, chemical exposure, sand, dirt.
So the main thing with eye injuries is to wash it with water. They can get, you know, chemicals in their eyes, they can get sand, they can get dirt. just flush it with a lot of water. The clear part of your eyes, the corneas, are very sensitive. And if you have even a little scratch in that area, you will have an amazing amount of pain. So you gotta wash it. After everything is out, if they're still in pain, just take them into the doctor to have them checked. If they're having problems because it hurts too much, even if you cover that eye, for example, if they're complaining of pain in one eye, for example, you cover that eye so that it doesn't get anything else in there, and they're still complaining of pain, they're still they get really anxious, just cover the other one too. They're going to be a little uncomfortable at first, but what happens is our eyes move together. We can't just say, I'm going to keep this eye, not moving, and then move the other one. So every time you're moving, you're looking around, your other eye is moving with that one. So that creates a little bit of pain in the other side too. So if you have them cover both, that sometimes helps a little bit while they get to the help they need.
And when you say wash it, you're not talking about for a couple of seconds.
I'm not.
You're serious about this, like 15 minutes.
Yeah, so most of the recommendations is to wash it continuously for 15 minutes. And if you go to any, the work areas that actually work with chemicals, they will have an eye wash center. It's like two stick, it's like that, and then water comes out, you just stick your head in there. And the recommendation is that it's just continuous water for 15 minutes and see what happens. If you're still complaining, still have pain, definitely any visual acuity issues, start seeing double, blurry, anything like that, they need to seek the attention of medical personnel.
And while we're on the subject of these kinds of things, of the scratches and bruises, another big one, animal bites and scratches. Same basic advice, right? Wash it out.
Same.
Watch for infection.
Yeah, the most important thing to remember is with animal bites, they tend to get infected quite frequently. So because our mouths are very dirty, animals are the same. So if you get a bite where it breaks the skin, definitely if you get a large enough cut or laceration where there's significant bleeding, they should go and see their doctor, because more than likely 98% of the times we do put people on antibiotics preventively, so that a simple cut doesn't become a very complicated, infected, deep wound.
And people worry a lot about rabies, but that's not as much a concern anymore, is it?
It's not. Thankfully, it's not. We don't see it that often to start with. Most of the animals that are around where we live are not a big issue, a big problem with rabies. Our cats and dogs, most of them have their vaccines are up to date, and it's not a big deal. So if you go and seek medical attention, they will call the appropriate authorities and investigate, but you can call your neighbor if your neighbor dog or if it was yours. if they were vaccinated or not.
Right.
And if they were, then you don't have to. It's a very long process. It involves a lot of
scares
sticks.
people.
Yes,
Yeah.
it scares them a lot, but most of the times it's not a big deal.
But go ahead.
Oh, no, I was going to kind of expound on what we were saying about bites. The large tearing injuries are always the most concerning to the parent because of the bleeding. They're actually the least likely to get infected because whatever bacteria contaminate has been introduced is usually being kind of flushed out either by washing it because it's open or by the bleeding that occurs. Parents need to be very concerned about the puncture bite wound. The cat, for example, with the tiny little sharp needle that punctures the skin, comes out and the wound immediately closes. Any type of bacteria that's introduced under the skin in a closed space can cause a rapid and devastating infection, particularly if it occurs around the tendons or joints in the hand, which is usually where it occurs in children who reach out for the cat or reach out to the dog. So even if a bite does not look that concerning to the parent, it's a small puncture, it's probably worth paying very close attention to it, and at the earliest signs of any swelling or redness, seeking medical attention in an emergency room. Cat bites are notorious for causing intra-articular infections and infections around the tendons of the hand that can rapidly spread.
That's a great point because most parents would say, "Oh, that's no big deal. He's not bleeding," but in fact, that's the one.
Those are the ones you got to watch out for.
And then, there's just one common sense thing to do is teach your children to always ask a dog owner's permission before petting the dog. And don't approach animals without the owner's permission, or reach over the fence or climb over the fence to pet a dog, or God forbid, a zoo animal. I mean, which has happened. So, you know, it just, some of that is just the teaching of your children to just, you know, understand that that dog does not belong to us. You need to ask permission first, and, you know, much less likely to get bit in that situation. Let's turn to firearms. So, controversial subject. We're not going to get into the controversy. We're just going to make this clear. If you own a gun and you've got a kid, or if you don't have a kid, you keep it locked up. It's not some anti-gun message. Even the NRA says that if you have a gun, you should lock it up and store them apart from the ammunition. So, you know, that said, if somebody feels like they have to have a loaded gun in the house for safety, and no one's saying you should or need to do this, but if you're doing that, you're undertaking a huge responsibility, because that gun can get into the hands of a child. You do not keep it in a drawer or leave it on the counter in your purse when you come in the door. I mean, you've got to do something to make sure that you take care of it safely, and that includes taking a course on how to possess a gun safely. You know, the other thing is, a lot of people will say, well, hey, I don't believe in guns, so, you know, this isn't an issue for me. Well, the fact is, you may not believe in them, but they exist. And in fact, they exist in half of all US homes. So it is very important to teach your children about gun safety. And you can start this process by just asking them a question. If you saw a gun at somebody's house, what would you do? And the answer might just shock you what they would say. So a lot of them would say, I'd pick it up and pull the trigger. And you've got to teach them very simply how dangerous that is. And the simple advice is, if you see a gun, you quietly leave the area, you don't touch it, and you tell an adult. That is good advice that keeps them away from a very dangerous situation. And, you know, it doesn't happen that often that kids are killed by guns, frankly. But that said, it's a completely preventable injury. And when I talk about not having that often, I'm talking about accidental shootings. But it's entirely preventable.
The majority of kids who sustain injuries from firearms sustain them due to a firearm in their own house. I mean, these aren't kids who are walking down the street and get caught in a gunfight between drug dealers. It's usually a firearm that's owned by a parent or a friend's parent. So I agree, setting up educational barriers are as successful as setting up physical barriers, and possibly more important.
Yeah, and that's a nice segue into, you know, you talk about the gun battles between the drug dealers. I mean, one nightmare everybody has about their kids is strangers. And, you know, this is a very tough conversation to have with your children about this. But there are a lot of good videos out there that can help you teach your children to avoid something like kidnapping by strangers. And you've got to make your child understand, basically, that they're not supposed to go anywhere with someone they don't know. Not even another child, without getting your permission. And you can role play and make this second nature. There are a lot of things that you can do. And you can teach them to do it in a polite manner so that they don't have to come off as disliking all other people. For example, someone says, well, I'd like to give you a treat. I have to ask my mommy for permission before I have a treat, and go get mom. That is a logical and polite response, and something that can be done. But, you know, what's interesting is strangers are not the main threats to children in terms of violence. Most people don't realize that, but most acts of violence against children are perpetrated by those who are supposed to care for them and supposed to love them, not strangers at all. And, you know, you've got to teach your kids that there are no secrets that an adult or older child should have with them. And that an adult or older child touching them in some places is just inappropriate. And that if that happens, they need to tell them to stop, and they need to talk to you about it immediately. And, you know, that's a very important thing. It's a conversation that all adults should have with their children.
And you'll be surprised, because the kid that, you know, the toddlers, the 5 to 6 year olds, they cannot discern between kind of what's right and what's wrong. And if you're used to telling them this is a secret between you and me, just don't tell mommy, don't tell dad, or grandma comes over and does that. Those secrets, when someone else tells them, hey, this is a secret between you and me, don't tell mommy or daddy, then you get into that problem. I mean, they don't know, is this right or is this not? I mean, they don't know. They can't discern it. And for me as an ER doc, when I see a kid, we obviously do a lot of exams that we're looking at the genitalia of boys and girls. And I tell them, the parent's always in the room, and I make sure I let them know, hey, we're going to examine you in your private part, and no one should do this except for mommy, daddy, or the doctor. Okay, this is not right for anyone else to do it, and we're going to do it because you're ill, or we're looking for this, we're looking for that. So we make a point of making it very, very clear to them so that they don't fall into this trap later on.
And aside from sexual abuse, it's worth talking about non-accidental trauma or child abuse. I mean, there's domestic violence in the house, and then there is what we term non-accidental trauma, child abuse. The statistics are concerning. The rate of mortality, death, is exceedingly high. This tends to occur most frequently in children who are in the youngest age group, less than 1. They can't protect themselves. They're very fragile. Children who cry a lot can elevate the stress level in the house. This results in the classic shaken baby syndrome, trying to get the child to stop crying by shaking the child. It results in severe head trauma, spinal cord injury, spine trauma, and extremity trauma. The rates of mortality are high, but when children do survive and the parent doesn't bring it to someone's attention, or if it's missed in an emergency room or hospital setting, the rate of recurrent trauma approaches 50%, and the rate of mortality in that patient subpopulation is actually upwards of 10%. In other words, if a child is abused and lived, and it's not recognized and the child's not removed from the abusive situation, 10% of those children will show up again dead. 50% will show up again with another fracture, head injury, or possibly permanent neurologic deficit.
And that's why doctors have to be and are so vigilant about this. And that raises another issue, which is spanking. Mm-hmm. Parents, look, it's controversial. And, as to whether, and there's debate as to whether it's effective, frankly. And a lot of the sociological research says it's not. But there are people who maintain that it's necessary and required. And I guess what I would say about it is, as a lawyer, looking at it legally, there's no clear line here. There's nothing that says that this form of corporal punishment is not child abuse. And so anytime you take it upon yourself to spank a child, you are putting yourself at legal risk in 2 ways. First, if you overdo it, you could very well be debating with the state as to whether you have a right to keep your child. And then secondly, and there is no clear line there. There is no way to say, well, I just spanked him, like this. It doesn't work that way. And secondly, if it's done and the child is struggling, a lot can go wrong, including, an unintentional injury where the child falls forward, strikes his head on a corner of a table or something like that. And now you're down at the emergency room explaining I was spanking the child and he fell into the corner of a table, and that's just not a good situation. You really exposed yourself to a lot of risk for something that's debatably effective.
Yeah. And know that if you're ever in an emergency department and any of the staff has any question whether anything that happened to your child looks like it could remotely be because of child abuse, they will call Child Protective Services. The law requires us to do it if we even think that this could be something related to that, because an inquiry will be done. They will go in your house, look in your house, and we're not doing it because we think you're bad parents or we're gonna get at you for X or Y. We're just doing it to protect the kid. That's the most important thing. It's always to protect the child.
And, you know, we'd be remiss if we didn't talk about domestic violence and its effect on women. The statistics are shocking, to say the least. Number one killer of females aged 14 to 44. It is the leading cause of injury to women, more than car accidents, muggings, and rapes combined. 1 in 4 women has experienced domestic violence in her lifetime. You know, as a lawyer, I've done a lot of pro bono work for domestic violence victims, representing them in court, getting protective orders, helping them out. And I will tell you that these abusers are not what the media suggests, the stereotypes, the guy in the wife beater who's drunk and inarticulate. Many of them, the reason they do it is because they can get away with it. And the reason they can get away with it is they are charming, they are personable, they are very shrewd at manipulating their victims, they are good at making the woman feel like she's the only thing in the world that matters, and they are terrific at begging for forgiveness and convincing somebody that it will never happen again. And that's just a lie. If it happens, when domestic violence advocates talk about a cycle of domestic violence, they are talking about this very process of a violent incident followed by the convincing of the victim that everything's okay and it's not going to happen again. And then what happens? It gets worse the next time because the victim has been sort of sucked into this belief that not only is this the right person for her, but that, you know, that he really truly cares for her. And it's just amazing how that process works and how insidious it is, frankly. You know, but as a mom, you've got to recognize that violence against you will almost always be violence against your children in one of two ways. First off, 50% of the men who frequently assault their wives also frequently abuse their children. And secondly, men who as children witnessed their parents' domestic violence were twice as likely to abuse their own wives than sons of nonviolent parents. So what do you do if abuse starts? First thing is you go to a shelter and you end the relationship and you seek a protective order and you get your children out of that environment. He's not going to change. He's not going to get better. It's only going to get worse. And what's interesting is the studies have shown that access to a shelter leads to a 60 to 70% reduction in incidence and severity of reassault. And that is an amazing statistic. And it's more effective than just getting a protective order. It's more effective than just leaving the situation. And probably the reason for that is because if you have access to a shelter and you use it, there's counseling there and there's assistance to make you realize that this was not an appropriate relationship. But obviously that's something that all women need to be concerned about. And at the first sign of violence, don't think that he won't do it again just because he's charming and nice. That's just not reality.
Yeah, statistics are astounding, and if they have any questions on where to go, I mean, we see a lot of that, unfortunately, in the emergency department, and most emergency departments in the States have, you know, social workers have, you know, different places that they can recommend, numbers. Obviously, you can get that online, most of the things, but if there's a question, that's a safe place to go. They usually have police officers that can help you with the kids, and then get you to the safe place that you need to be.
Yeah. And that domestic violence is entirely preventable if someone leaves the situation, and of course, you know, gets the kids out of the environment. So, you know, in conclusion, I mean, I want to be clear about one thing. No one here is saying raise your children in a bubble. Don't do any activity. Don't play football. Don't play sports. Don't go skiing. Don't swim in the water. I mean, no one's saying that. What we're saying is, if you're doing it, realize what the risks are of it and take steps to minimize them.
And be prepared if it happens. Preparedness is everything. So you know, the kids are gonna fall, they're gonna hit themselves. We all did as kids, we still do it as adults. So it's just know what the steps are to actually take care of your kids if they're injured. Know where to call, what to do next. That's the most important thing, I think.
Okay.